So hello. Welcome back to my channel. Don't forget to like and subscribe and also support my small business at latricelimited.com. So you guys, this is just another reason why medical care should not be held with private companies. This is another reason why we need universal health care. Okay, so I have an article here that says the cash monster was insatiable. How insurers exploited Medicare for billions. Okay, so you have a lot of companies, and I will put a chart up here. You have a lot of companies that are saying you have some kind of disease and then charging you for that, and then they're getting money from Medicare. This is also what they were doing during the whole pandemic. This is what they were doing with COVID, because a lot of different hospitals were getting excess money if someone had, for COVID care or whatnot, right? So you have a lot of medical professionals say, yeah, this person has COVID, you guys, so they could get more money. So the hospital could then get more money being brought into them, even though it may not have been anything COVID related. You also had it on a flip side of that, misdiagnosis. Someone dies of a car crash or gets injured in a car crash, and because they had COVID, they said, oh, well, COVID caused it, which is like, no, that's not what happened at all, but we're going to get into this. All right. So we have the top 10 Medicare Advantage providers. Okay. And then we get to see how they victimize people. All right. So we have quite a few accused of fraud by whistleblowers. All right. So we got a column accused of fraud by whistleblowers, accused of fraud by the U.S. government, and then overbilled according to the Inspector General. Okay. Almost all of them overbilled. Okay. So that means that's more money either you're paying or Medicare is paying. However, that will work with your insurance, because let's be real, American insurance is really not that great now unless you got that top tier stuff. All right. But we have United Health Group. We have Humana. We got CVS Health. Okay. United Health Group checked all the boxes, them and Scan Group. Okay. They have fraud. They have overbilling. I mean, this is ridiculous. The health system Kaiser Permanente called doctors in during lunch and after work and urged them to add additional illnesses to the medical records of patients they hadn't seen in weeks. There's another reason why people don't like going to doctors, because you go there with just a cough, cough syrup. And then you leave out with some other crazy disease you didn't even know you had. They start adding on things. They start recommending things that you don't need, because a lot of this stuff, especially when it's like new products and stuff like that, like the stuff that you see with these commercials that really should be banned. Xanabar, it'll stop your insomnia or whatever, right? And you would see that kind of stuff. And if doctors recommend this and you get it, yeah, they get money from that. Okay. I don't think you should be able to get money from that, because you're pushing on something that really is even beneficial to someone else. I don't know. That's a really fine line. Doctors who found enough new diagnoses could earn bottles of champagne or a bonus in their paycheck. Exact same thing. Yes, you want a flight to, I don't know, insert Hawaii, the Bahamas. Hey, just go put some extra stuff into the charts, or you could go and promote this little pill that we got. Okay, right? Gotcha. Anthem, a large insurer now called Elevance Health, paid more to doctors who said their patients were sicker. And executives at United Health Group told their workers to mine old medical records for more illnesses. And when they couldn't find enough, send them back and try again. Wow. It just shows. I mean, there's greed in everything. This is also why you have universal health care. Everyone should be able to have the same kind of care. People should not be exploited because, I think you're dumb. You may be easy to manipulate. Let's say you got this. Let's add this in your chart. And then you mess around and you may get some kind of, some medication for something that you don't even have. It's ridiculous. Each of the strategies, which were described by the Justice Department in lawsuits against the companies, led to diagnosis of serious diseases that may have never existed. But the diagnosis had a lucrative side effect. They let the insurers collect more money from the federal government's Medicare Advantage program. This is ridiculous. And you get to see in different kinds of categories in the systems in the US. It says Medicare Advantage overbilling exceeds entire agency budgets. Okay, so we see how large this overbilling is here. They show NASA right under it. They got the Children's Health Insurance Program, CHIP. They got the U.S. Customs and Border Protection. They got the FBI, EPA, and then they got the federal prison system. And we see, everything's being overcharged. Okay, but we see that medical care is at the top. And that's the thing. People need medical care, whether that is people getting, just a regular checkup, or someone actually getting treatment for cancer or heart disease, heart problems, whatever the case may be. And you're just overcharging them to the point where, this is why a lot of people don't go to doctors unless they get to that point where it's like, oh, I need one. Because you may be like, well, why didn't you get your checkup every year? You're supposed to get your checkup every year. So they could overbill me, then say I got something else, and then my insurance doesn't cover it. If I even have insurance that could cover it, you know what I mean? And you got to pay more out of pocket. And then that's why you have people who wait so long. And then whatever issues they may have had, whether their lack of exercise, bad foods, just straight up genetics, or the environment that contributed to whatever possible disease that they may have currently, it's because they didn't get the treatment in the beginning. But if you make it extremely hard for people to get it, even if you do have good insurance, you still have to look at it like this. Okay, even though I do have good insurance, it's still hard. Am I in network? Am I out of network? Co-pays, all this kind of stuff. And they make it so difficult. And on top of that, they start screwing you over even more.